Caden Daly comes here every Monday with the same message. Daly arrived in St. John's from BC in 2017 to be closer to family while struggling with mental health issues. One of the professionals they needed to see was a psychologist.
It was actually very difficult. I was put on a wait list, and it was over 12 months before I got a call back saying that I had a possibility of seeing somebody. But by then I had already gotten a psychologist through another program because I had been in the hospital. Otherwise I would have been waiting 12 or more months to see somebody.
As of April 2022, Eastern Health had 25 vacant clinical psychology positions out of 56 and a half total. Some of those vacancies include temporary leaves of absence. Neuropsychologist Dr. Tanya Lentz left her job with the Health Authority last September for private practice. She had been working at the Janeway Children's Hospital's Rehabilitation Service and created the Pediatric Neuropsychology Service, assessing skills, abilities, and behavior.
A lot of it was just basically crisis management towards the end, simply because there was only one of me, and both of those services cover the entire province.
The demand was so high, Lentz says, that some patients were waiting 3 to 4 years to see someone.
A lot of times it was, well, do your best, or you need to learn how to manage your caseload better. So a lot of kind of gaslighting, essentially, is what we were getting from management.
She says it became unethical to stay because she couldn't properly treat her patients. Lentz is not alone in that assessment.
I think at this point we'd have to say it's a mass exodus, from the public system, and this is something we saw coming.
A year ago, Dr. Lisa Moores presented this report she co-authored to Health Minister John Haggie outlining issues reported by psychologists. It warned that there was already a shortage of public health specialists and that psychologists were unhappy. Moores says part of the problem surrounds stepped care, a model brought in about 5 years ago, matching the right level of care and treatment to the needs of the person who's seeking help. But Moores says psychologists have been left out of the development of this model and that there's been a shift away from long-term care, with psychologists reporting having to move away from intensive work with individuals to same-day walk-in services.
We've seen a real emphasis, a strong emphasis on programs. And on programs or models being the thing that will fix all of these problems. Programs don't treat mental health, right? Professionals treat mental health.
Moores presented 10 recommendations to government to stop the hemorrhaging of psychologists from the public sector. So far, she says, she hasn't heard back.
It's in a crisis, and I don't use that word lightly.
Dr. Janine Hubbard is president of the Association of Psychology Newfoundland and Labrador. She says demand is so high that even the private sector is struggling to meet demand.
Because we've had all these vacancies, we've got more people with more complex issues seeking out private services, whether they can afford it or not. And in some cases just desperate enough that they're trying to do that. But as a result, the private caseloads are full. We've spent months and months this year with families, at least in the St. John's area, unable to access a child psychologist, even privately.
Eastern Health says it's actively recruiting new psychologists. It's offering bursaries to grad students in return for service. Meanwhile, Health Minister John Haggie declined to comment for this story, but in a statement, the department said that it's created an Office of Recruitment and Retention for this very issue. As for stepped care, the province says that it's developing its own model using lessons learned from the first try. That model, however, has not yet been implemented. For Lentz, the way to keep her at Eastern Health wasn't difficult. Private practice is more lucrative, but she says that wasn't the primary reason for her leaving.
Money was the furthest thing from my mind when I was working in the public sector. It's about feeling valued, feeling heard, being able to provide ethically sound treatment for people, and that doesn't take a lot.
It's very disheartening, and it makes you
Outside the Waterford Hospital, Caden Daly hopes they'll never have to return, but says the fight for better care, well, that must go on.
It feels like the government is saying that mental health issues are a one and done kind of thing, and they're not. They're generally more pervasive.
Ariana Kelland, CBC News, St. John's.